We're live. So, Facebook and Instagram. Um, let's do this. Okay. Hi, everyone. So we have people coming in. Live from Verita, Neuro, Mexico. And today we're going to talk about stem cells um, and spinal cord injury, and how here in Mexico and Thailand in Verita Neuro we enhance the outcomes of the spinal cord injury with stem cells treatment. So I think we can start now. We have people getting in. So we have someone from Iraq. Hello. So I'm going to start, and we'll read the questions through the live. Okay. So let me talk about a little bit about spinal cord injury. It's we consider that a catastrophic event, and it's mainly due to traumatic causes, right? But non-traumatic conditions are also a cause of spinal cord injury. The symptoms depend on the severity of the injury and its locations, and if it's partial or complete injury, then we will see partial or complete loss of sensation, motor control, and obviously the involvement of the bowel, bladder, in some cases breathing, heart rate, and blood pressure. Uh, so it's an event that covers a lot of functions in the body, not just sensation and motor, as some people may think. So, during the spinal cord injury in the traumatic event, for example, there are some phases in the event. There's an acute phases triggered by inflammation, and that the body respond with some inflammatory elements such as macrophages, lymphocytes, neutrophils, and some chitosins that are some little proteins with pro-inflammation functions. So in that moment, the inflammation is the main cause of damage. After the traumatic injury, the inflammation is the main cause of damage. And in addition to the inflammation response, the inflammatory response, we have the formation of free radicals that play an important role in the secondary spinal cord injury damage. So, as you see in the event, there's a lot of things involved too, and that's why I want to talk about this before stem cells, because stem cells have so many different functions in the body. So we have the injury, then we have the inflammatory response, which causes more injury, and then we have this extra response with some free radicals that cause more damage, right? Um, so all of these mechanisms are involved in progressive damage of the tissue surrounding the primary trauma, and this is known as a secondary injury. So while the function of the spinal cord can be significantly restored if the injury is incomplete, there has been little success so far in improving function when the injury is a complete injury. So severe spinal cord injury is associated with disability and in sometimes decreased quality of life. So of course, our main objective in the clinics is to provide more function and more quality of life to these patients, right? There are several interventions to improve the lives of people with a spinal cord injury, including medicines, drug treatments, surgeries, rehabilitation, therapies, uh, but they provide, I want to say, not that good outcomes when we talk about the functions below the injury, right? That those interventions work really good in the functions that are left after the injury, maybe in a thoracic or a lumbar spinal cord injury, the hands, the trunk control, we can improve that a lot with all of that interventions. But below the injury, it's very hard to make some changes, especially if the injury is complete, as I said before. So it is important it's important for us to find an effective, safe treatment that can, in a way, repair spinal cord injuries. Um, and this reparation of the spinal cord injuries today is still far away. There are a lot of investigations going around in the world, and they promise a lot of things. So we are waiting for the final results. But until today, that full restorage of the spinal cord injury is still far away. So the use of stem cells in the treatment of spinal cord injury has recently entered, not that recently actually, because it has been going on for about maybe 15 years, but it has entered as a possible therapeutic application. So it's a promising tool for the manage of spinal cord injury. And some preclinical studies of stem cells and spinal cord injury prove the strength of the stem cells therapy to enhance motor outcomes. So it's this whole treatment is emerging as a hopeful therapeutic strategy for the treatment of the spinal cord injury. So I'm gonna full go into the stem cells. Now we have talk about the spinal cord injury, and I want to talk a little bit about stem cells, and then unite both topics. So a stem cell, as probably maybe some of you already know, is a non-specialized cell capable of dividing indefinitely and differentiating, that's like transforming into different types of specialized cells. So there are a lot of types of stem cells, and we can talk a lot about type of stem cells. I don't want to get into that topic right now. So I'm going to talk about what appears to be the most interesting treatment for spinal cord injury, which are mesenchymal stem cells. So the mesenchymal stem cells are very interesting for the treatment of spinal cord injury because they have the ability to differentiate into different types of tissue. That's cartilage, bone, fat, and also nervous tissue. And that's why they are interesting in this case. And they are capable of regenerating damaged nerve tissue. And this has been demonstrated in several in vivo studies, not just in vitro, but in vivo studies using experimental models of spinal cord injury. So, in several these preclinic studies conducted on animals and on humans. I'm going to talk first about the studies of animals and then about human studies. Stem cell therapy has promoted and enhanced motor activity and neurological functions after a spinal cord injury, and that's why we use those type of cells. Um, you can get mesenchymal stem cells for a lot of from a lot of tissue, bone marrow tissue. Bone marrow stem cells are mesenchymal stem cells. Adipose tissue stem cells are considered mesenchymal stem cells. Umbilical cord are considered mesenchymal stem cells, and amniotic fluid cells are considered mesenchymal stem cells. So we can get them from a lot of tissue. We usually get them in Verita Neuro from amniotic fluid and umbilical cord. So other important things are that in the treatment and deciding which cells we can use for the treatment are that mesenchymal stem cells raise no ethical concern about risk or nothing about developing tumors. No ethical concern. They do not show cytogenic variation when they expanded in culture for long periods. So actually, they're very safe and very effective cells. Um, but here's the interesting thing. They also exhibit immunomodulatory and anti-inflammatory effects. So this anti-inflammatory role in various immune system disease that they have, and some anti-inflammatory in some anti-inflammatory disorders too, they have been proved to suppress the T and B cells. Those are lymphocytes. The T and B cells proliferation rate, and then they promote an immunoregulation state. So this is very good for the initial states of the spinal cord injury, as we talked about, and they have been proved also to reduce apoptosis. Apoptosis is the programmed cell death, right? So they reduce apoptosis, and they reduce the use of pro-inflammatory cytosins we talked about. So they prevent in some way the second phase neural damage after a traumatic injury. So it's not only the restorage of the neural tissue, but it's preventing in the acute state the secondary damage of the spinal cord injury. So as you can see, they have a lot of properties that help us in this way. So uh, I'm gonna get a little technical right now. So in this, but I think this is important. In 2006, the International Society of Cellular Therapy published the characteristics that mesenchymal stem cells must have, and obviously in our labs we fulfill those characteristics. So some of those I'm not gonna get into each characteristic, but some of those are the presence of some surface antigens, which are called CD and then a number, and the absence of another surface antigens, CD and another number, right? So obviously we have certifications for that. So our cells are very good cells, mesenchymal, very good stem cells, and very safe to use. Um, so there are several studies in humans too. For those who know about investigation, there are phase two, phase one, phase three studies in humans about stem cells that promise a lot of changes during the acute state of the spinal cord injury, and then the subacute state and the chronic state too. So stem cells cannot be used only in the acute state, but also in the subacute and chronic states of spinal cord injury, and we can better, we can get better all the functions below the injury in every single phase of the spinal cord injury. But obviously, the acute and the subacute are like the most important ones, right? So, one thing to consider about the stem cells is the administration of the stem cells. So, this is essential for the efficacy of this therapeutic intervention. So, there are mainly three ways to administer stem cells in a spinal cord injured patient. One is the IV, which is an intravenous administration of stem cells. Then we have the intrathecal. So the intrathecal is actually a lumbar punction where we go and put the stem cells into the spinal fluid. So that way uh, we can get the stem cells to the spinal cord directly, and this is very important because the stem cells are big cells. So when we do the intravenous administration, we have a blood-brain barrier, which is a protective barrier for the central nervous tissue. And that barrier, what it does is it doesn't let big things pass to the central nervous tissue. So stem cells cannot pass the blood-brain barrier. So when we put them intravenous, they do not, we're thinking they are not passing that barrier. So the intrathecal is a very good way to get into the directly into the damaged cord. And there's another way that is the intramedullary or intracordal way of applying the stem cells. And that's a little more invasive. What we do is things called laminectomy. So it's a little surgery where we take off a piece of the bone of the vertebra and then inject micro injections of the cell directly into the injury. So these three ways actually are the best and are the ones that we can consider for administration. They are all considered safe. However, intravenous and intrathecal injections are less invasive than intramedullary administration, but all of them are considered safe. They have some risk, as any medical procedure we do, and but they are considered a safe way of getting the stem cells there. So um, I'm gonna talk about a topic right now, which is I want to just let us know, everyone, the statistics in the world that a change from from a stage to another of spinal cord injury patients is not that common. So we classify the spinal cord injury with a classification that's called Asia spinal injury classification. This classification gives a letter to each stage, and there's Asia A, which is a complete injury, Asia B, which is a motor complete injury but sensory incomplete injury, and there's an Asia C, which are motor and incomplete injury, and D, to motor and incomplete injury, and sensitive incomplete injury. So actually, the changes, the statistics that we have is the change from Asia A to Asia B. So for a complete injury, motor and sensory injury, to complete motor injury but incomplete sensory injury, it's just 5%. Just 5% of the patients. The change from A, so this is a motor and sensory complete injury, to B, to C, I'm sorry, which is a motor and sensory incomplete injury, is just 2.9%. So as you can see, these changes are not that frequent, not impossible, but not that frequent. But the stem cells make that more possible. So that's why it's a very, very good treatment for spinal cord injury. So, considering these global statistics of recovery after spinal cord injury, we have observed in our patients in our clinics that the use of mesenchymal stem cells, together obviously with a neurorehabilitation treatment, a complete neurorehab treatment, can induce neurological function changes below the injury of level, the level of injury in patients with this traumatic spinal cord injury. So actually, we have very good changes in our patients, and we are actually very proud of this treatment. So I'm going to read some questions because they are starting to accumulate here. I'm going to start here. Sorry, I'm just going to read the questions. Intrathecal have better effects that IV. Yeah, because we're thinking IV is not going through the blood brain barrier. So yeah, intrathecal obviously is the way to go. Um, does time frame matter when you receive them? Yes, that's also an important thing because of what we said before. In a acute or subacute injury, then we can have some changes in the secondary damage of the injury. So yes, of course, times matter, and the sooner the better in the spinal cord injury. But we have had cases of people with 10 years after the spinal cord injury, they received treatment with stem cells and they have neurological outcomes. They got better. So yeah. Um, does the time period date from the injury? Yes. Let me see. Let me see. Long do I have? Okay. How long do I have to wait? This is kind of a related question. How long do I have to wait between my injury and the stem cells? Actually, nothing. If the injury is stable after, if you have surgery and they stabilize your spine, you we can put stem cells whenever you want. So yeah. Is this? Let me see. We have some more questions here. Hyperplasia, but it's not cut or still in a spinal shock. So yeah, in a spinal shock, actually, it's a very good time to put stem cells because of the secondary injury. So yeah, actually the best time is before the first year. Um, but after the first year, you can have good results too. Let me see if are both location provide the same services. Yeah, Thailand and Mexico provide exactly the same services. So yeah, you can choose either one. Okay, so I have more questions here. Um, is ES and spinal and stem cells together effective for 2 years after the spinal cord injury? Yeah, actually, when we do the epidural stimulation treatment, we do stem cells along it. So yeah, and 2.5 years is a very good time to do both. So yeah, of course, cost. Yeah, the cost it goes around maybe 20 to 25,000 dollars, but you have to remember that our treatments are complete treatments, not just the application of the stem cells, but it includes everything. You'll get neurological PT. You'll get a lot of things in the treatment. every patient is um, it's evaluated in the medical teams. So every case is individualized, and we try to do this treatment like individualized treatment. So yeah. Let me see if there's another compressed spinal cord due to bleeding to, yeah, yeah. If you have a this doesn't work only for a traumatic spinal cord injury. So yeah, they work for a lot of injuries, of kind of injuries, including sometimes tumors. If the tumor is gone, then we can talk about spinal about stem cells. Yeah, subcutaneous device. I don't know what's that. Let me see. How long do they stay with you guys? Okay, so this depends on the treatment. The spinal, the I'm sorry, the stem cells treatment. Usually, we need 1 or 2 weeks here to the full treatment. You do multiple treatments, or is it a one-time thing? Okay, so yeah, the treatment actually it's divided in the same stay in the week or 2 weeks that the patients are here. We divide the treatments into intravenous, and usually we put two intrathecal applications of stem cells. So it's divided in three, usually, and this is this along the week or 2 weeks that they stay here. Um, do you, what risks are associated? This is a very good question, and I'm glad that you asked. The stem cells are administered through injections, so actually the risks um, are all about the injections. Um, the first risk is infection, which is a very, very low risk. I mean, it's the same probability as having any an infection from any kind of injection. So injections here, injections in the gluteus, it's a very low possibility or probability, but it's still a risk. So what we do is we do not just put an alcohol and an alcohol pad and do this as an injection. We usually do the application in a room where we have everything controlled. The application is done by a certified anesthesiologist. We clean the area as if we're gonna do surgery. In most of the cases, we put everything. We put some pads, sterile pads too, and all of our material is sterile too. We take a good care of that. The other risk is to touch a neurological structure with a needle. It's a very low risk too. Actually, I think it had never happened here in Verita, but it's a risk. So we do the application in the lumbar part of the spine, and that way we make sure that we don't have that much neurological structures there, because the spinal cord injury ends probably in an adult in an L1 level, and so we go below that. So that's other risk, there are secondary effects, or I don't want to call them risk, but you can have headaches after the intrathecal application, and that's a normal thing. It lasts for about 24 hours and then goes away. You can have, when we put stem cells in the vein, you have to remember the stem cells are an orthobiological product, and they they are circulating in the bloodstream for about 24 hours before they are absorbed by organs and tissues. And in those 24 hours, you can have the same effect as a vaccine, like a COVID vaccine or any kind of vaccine. Also, when we put the stems intrathecally, as they go to the injury and stimulate it in the first days, you can see you can have a little bit of rise of the spasticity or neuropathic pain. That's transitory, just lasts for a few days, and it goes away without doing anything. So actually, I think those are the risks that we can take care of. You said you do three treatments into, but will the settlements need to be repeated? Okay, so after the first treatment or week or two, does the stem cells have to be repeated? Yeah, it depends on each patient. So after the treatment, we have like a 2 to 6 months period to see the results of that treatment. That results are not immediate, and they last. They have to be like a 2 to 6 month period to see the results. And we talk to the patients after this. So if the results are good, then we can talk about a second application or a third application. So yeah, sure. We usually wait 6 months for the second or the third or the third application. Yeah. What is the period of time required after settlement to feel better? Yeah, exactly. So I think I answered that question. Does the intrathecal injection into the spine hurt? It depends on the level of the injury. So if the level of the injury is it's above the injection site, no. If it's below or if it's an incomplete injury and we think it can hurt, then the anesthesiologist put a little bit of anesthesia in the zone so it doesn't hurt that much. Okay. Let me see if we have another question here. 14-year-old of spinal cord injury, C4 and C5, can I take the treatment? Yeah, yeah, of course you can take the treatment. The treatment is a safe treatment. It usually gets to improve the neurological condition, but you have to remember that the more time it goes from the spinal injury to the treatment, the less outcomes we can see with the treatment. That's a fact. So yeah, you can do, of course, after a 14-year treatment, you can do stem cells, but we have to set some goals and expectatives, expectations with you. Yeah. So let me see. Uh, are the programs? I don't understand this question. Let me see. What was the cost of the stem cells and the periodic stimulation? Both that cost is about $108,000, I think, right? Yeah, $108,000. Um, let me see if we have how much time to stay there for the stem cell therapy. We have answered that. Are you only located in Thailand and Mexico? Yeah, we are only located in Thailand and Mexico. Um, but one is as far as the other, so you can go either way. Let me see if we have some. This is a very good question. Are anyone non-responder? Yeah, we have non-responders patients. Yeah, we have seen that about 5% of the patients are non-responsive. So yeah, of course, as any treatment, as any medical treatment, I think right now there has not been any medical treatment with non-responders. So any medical treatment, antibiotics, surgeries, we have non-responders. It's a very little percentage. It's about 5%, but yeah, of course, we have non-responders, and that's a very good question. And we say that to all our patients. Yeah. Let me see if we have anything else. So let me see. Mm, Okay, that we've answered. I think we don't have any more questions. If anyone, oh, they are telling me I froze up. Is this is this right now corrected? I mean, is this solved? I don't know. In Facebook, right? What about complete severe? Um, so what about a complete severe injury? Yeah. So complete severe injury usually have outcomes if we do it in a good period of time. I mean, in about a year or two. We have to check that with our medical team, the neurosurgeon team, but usually no. Okay, 2.5 years. So yeah, the 2.5 years is a very good time to come. Yeah, even with a complete severe injury, of course. Yeah, yeah, yeah. Someone said I have questions. So if anyone have more questions, please let me know. Um, gunshot victim, spinal cord, not severe, but I'm complete paraplegic from waist down. Yeah, we have had patients with gunshot injury. It depends on the severity. If the injury was not severe and it was from the expansive wave from the gunshot, it usually worked. Yeah, you usually have outcomes. So, but when I said you get better or you have outcomes, I don't mean the spinal cord injury is cured, right? As I said before in this talk, there's no cure for spinal cord injury right now in the world. What we are aiming with these treatments, any kind of treatments that we do in Verita Neuro, is to get the quality of life, better the quality of life and the function below the injury. Okay, so I have to be very clear about this because we don't have anyone, no one in the world has a treatment that cure spinal cord injury. Okay, so yeah, what if it's from a gunshot wound? Will you still treat? Yeah, if you don't have, we just have to make sure where if you have the projectile in the body, we just want to make sure that it doesn't interfere with the treatment. But that's it. Yeah, we can treat it. Yeah. I was injured in 1997. Incomplete. Oh, so incomplete. Would it help me? It has been a long time, but the other thing is that if you're incomplete, um, yeah, it maybe can help because of the incomplete injury. Yeah, we can try. How many passes? Okay, so there's someone that knows about stem cells. How many passes do you do with your cells? For neurological conditions is the first pass always. So I'm glad you asked that. Yeah, it's the first pass always for neurological conditions. Does the cost include the stay? Yeah, of course. It includes the stay, the meals, the transportation in Thailand or Mexico. Yeah, 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 yeah. It includes everything. Oh, I mean, transportation, stay, meals, therapies, stem cells. No. What if you had spinal cord tumor cancer? I use stem cells? Okay, so this is a special case because because we have to see what type of cancer and the stage of the cancer and how's the cancer at the moment. We have used stem cells in cancer patients. The mesenchymal stem cells have been proven not to cause any kind of tumor, but still we have to be very cautious of using them in cancer patients. So that's a very difficult question to answer right now because we have to see each case individually for that. Do you recommend the stimulator and stem cells for T11, T12? The bad news there is in a T11, T12 injury, we can usually do not colocate or put the stimulator. It's too low. So actually, that's where we recommend stem cells and neuro rehab treatment. Yeah. Um, this another question. Stem cells not FDA approved. How you guarantee your treatment? Okay, so um, the FDA do not approve stem cells treatment if it's not a bedside procedure. We are members of some American associations, actually from the American Spinal Injury Association and from other American association, and we know that FDA just approves stem cells treatment if they are bedside procedure. That means stem cells cannot leave the room after you get them from the patient, right? So you have to get bone marrow patient stem cells, and you have to harvest the stem cells in the room where you get the bone marrow aspirate. So that's what the FDA says in the United States. In Mexico, we are not ruled by the FDA, nor in Thailand. And in Mexico, actually, we have legislations and laws that we have to fulfill to have a stem cells lab and use the stem cells in our patients. So the stem cells lab had to have certain characteristics that we have, and the stem cells that we put in our patients have to have a certain characteristic that we obviously have, and those are called certifications. And we have all the proper certifications to do and guarantee our treatment. That means certification on viability, on the surface antigens that are that tell us that what we're putting our mesenchymal stem cells that they doesn't contain or may contain any bacteria, virus, parasites, anything that can harm you, we have a certification that they cannot go into a tumor lineage or cause any tumor at any time. So yeah, we have a lot of certifications that make our treatment be safe, and it has been safe for the last 10 years. We haven't had any big complication. I don't think any complication in about 10 years. So, any other keep up with the good work? Thank you. How long is the stimulator in your body? Okay, so I'm going to talk about the epidural stimulation. That's okay. So the epidural stimulator is placed over the spinal cord and it stays there as long as you want. The longest of one of our patients that have had, I think it's 9 years, maybe right now. Yeah, and so it can be placed and conserved in the body. Yeah. Do you use umbilical cord stem cells? Yeah, we in Mexico we use umbilical cord stem cells and warm jelly stem cells too. Yeah. In Thailand we use amniotic fluid stem cells. Yeah, but they are mesenchymal stem cells, same results. Neurogenic. Let me see if there's some other questions. Let me see here if we have other questions in on Instagram. Is there a number to the Guadalajara hospital for questions? Yeah, sure. A phone number, if you want to write it down, is plus 52, which is which is Mexico, and then 33 45 21 2344. That's the number in Mexico Clinic. So it's plus 52 3345 212344. Yeah. Um, Let me see. Uh-huh. Is it possible for a patient with complete severe nerve T3 to 4 region uh, of the spinal to recover? After any kind of spinal cord injury, it usually there are few people that goes uh, from the spinal cord injury to a thing we call Asia E classification. Asia is you had a spinal cord injury, but right now you don't. That's basically it. There are very few people that goes that walks that path. They usually the people usually keep some of the injury and the disability, but we can help with our treatments for the disability to be less and the quality of life to be better. So again, there is no treatment to cure spinal cord injury in the world. So yeah. Uh, Let me see if we have some another questions. Tina incomplete. Tina incomplete and Tina incomplete. Yeah, you can go probably under an epidural stimulation treatment, and does the 108 case cover stay while being treated? Yeah, of course. Yeah, yeah, yeah. And a stay for you and a family member, and meals for you, and everything during your stay here in Mexico. Everything from medical wise, you know. Um, okay. Uh, what kind of patients do you select? Okay, so for spinal cord injury, we have a very wide range of patients to select. So it can be at any level of the spine, the injury, and it can be any kind of injury, like Asia A, B, C, or D. We can do it. Just remember that the most significantly uh, uh, thing on that is time, the time, right? If patients have 20 years, 30 years with a spinal cord injury, then uh, the outcomes may be not as good as in the first stages or the first years. But we talk about this with every patient that consults with us. So we individualize every case, and we have a talk about expectations with every patient. Yeah. Okay. What do you recommend for some spinal in shock? If you're in a spinal or someone is in a spinal shock, actually we recommend stem cells treatment. Yeah, to try to lower the secondary damage. Um, do you have to have a passport to come for treatment? Well, if you're not Mexican or Thailand, yeah, you need a passport to get in the country. Yeah. Hmm? In Mexico, I don't know. It depends on the country for the visa. The United States, Canada, I think they don't. The United States don't need visa. Canada, I think they don't. And most parts of Europe, they don't. So let me see. Can the therapy be done on an 8-year-old child? Yeah, yeah. The stem cells therapy, yeah. The epidural stimulation, no. But the stem cells therapy, yeah. We have done it in, I think, 5 or 6-year-old kids. Yeah. And the kids have something called, how do you say it in English? Neuroplasticity. So the outcomes in kids are quite good. Yeah. Do you prefer one location over the other? No, actually, no. We are in Arkansas. No, both locations are equally good. They we do the same treatment in both locations. So no, no, no. You can go Thailand or Mexico equal. Let me see. That we have answered. Is there any examples in the history of medicine where a patient with a complete severed spinal nerve has made progress in treatment? Yeah. I mean, this is maybe an ambiguous question, but yeah, of course. I mean, we have talked about that maybe 5% of patients with Asia A go to Asia B, 2.9% of patients with Asia A go to Asia C. So that's a quite a good progress. With the treatment, yeah, of course, we have. We have examples in both clinics. Yeah, and we have been working with this for several years. So yeah, yeah, of course. And sometimes we we even have been asked for patients if we can give the phone number of another patient that was here. So we have to ask permission to a patient, but we have done it before, so they can talk about the experience. Yeah. Um, Let me see if there's something else. Yeah, Lamispine, according to our website, is only offered in Thailand. Yeah, that's true. The Lamispine is only offered in Thailand. Yeah. Uh, Let me see if we have something else. No, no, I don't see anything else. There are a lot of questions. If I'm missing some question, I'm sorry. Uh, if there's another question, do you do Lamispine in Mexico? No, not to the moment. Do you address root nerve damage? Well, this is not properly a spinal cord injury. Root nerve damage, yes, we can address it, at least here. Yeah, we can address it, but it depends on the patient. Always depends on the patient, on the how damaged it is, in what level it is, and the all the things going on. Any fatalities? No, no. Fortunately, no. Um, will this be available in Canada in the future? I don't know. Are you talking about stem cells? I don't know because it depends on Canadian legislation and some things that I'm not completely aware of. So I don't know actually, but you can come to Mexico if you want. Um, why not continue with the treatment if it is uh, benefiting and keep injecting the cells? Yeah, we can continue with the treatment. Actually, if the patient has a good outcome, we usually continue with the treatment. So we have had patients that have come 3 or 4 times. Yeah, and still improve. Um, do you have, I think, patients, because it said parents, but do you have patients with high muscle tone and spasticity? Yeah, actually, the majority of our patients have high muscle tone and spasticity. Yeah. Um, T5, T6 complete injury, do epidural stimulation and stem cells both. Yeah, yeah, we do both. Have you had anybody walk out of the facility after the treatment? Okay, yes, one patient, but this is not the usual thing. So we had a patient that came 15 days after the injury. He was here for 35 days for neuro rehab program and stem cells treatment, and he left walking with a cane. But this is one patient. It's very important to understand, and very acute. He was 15 days after the injury. Actually, he went into surgery, and when they discharged him from the surgery, he came right into the clinic. So it was a special case. Um, yeah, but yeah, one patient has got walking. Um, we fill out the form from someone to contact us, and no one has calls back. Okay, so I'm gonna write Christy Lamar. So Christy Lamar. We'll have someone contact you. Um, any spinal cord degeneration from B2 deficiency? No, we haven't had any patient with spinal cord degeneration from B2, B12 deficiency. No, we haven't. Mhm. So let me see. I'm going to read this because it says a Spanish talking patient, and the question is in Spanish. I'm sorry to read this in Spanish. Mi nivel de lesión T12 hace 10 años atrás, parapléjico sin control de esfínteres, me imagino que es. Tengo posibilidad con esta terapia de Chile. Eh, sí, pero tienes que tener en cuenta que llevas 10 años de la lesión. Y acuérdate que pasando más tiempo de la lesión, menos probabilidades tenemos de tener esos cambios mayores en la lesión, pero sí ya hemos tenido pacientes hasta de 13 años que han tenido cambios en su lesión con, eh, con las células madres. So I'm going to say this in English. T12 injury 10 years ago. If there's any chance with this therapy, yes, there's a chance, but you have to remember the more time it goes, the less outcomes or these spectacular outcomes you can have. But we have had a 13-year patient with good outcomes, neurological outcomes. So yeah. Let me see. Actually, we have reached an hour, so I'm gonna read maybe one more. Um, Let me see if we have. So Amanda Hall, to contact Amanda Hall too, please. Oh, so yeah, actually they are answering. Yeah, for from Verita Neuro. Perfect. Um, Let me see. Well, I think we're gonna finish this live. I want to thank you all for all your questions. And the participation has been amazing. I hope we left some value in all of you with this talk. And of course, if you have more questions, we are gonna be continue answering all Facebook and Instagram questions. If you have any more questions, please contact us through website or social media. We'll be happy to answer you. And if anyone has wants a consultation, please fill our forms, and we'll be happy to do it. So thank you for being here. Thank you for all the questions, and we'll see you in the next live. Bye bye. Listo.